What if I told you that some of the biggest mistakes cancer patients make aren't always related to the disease itself, but to the choices they make after the diagnosis? Many people unknowingly delay treatment, ignore medical advice, push their bodies too hard, or stop treatment too early. These decisions can make recovery more difficult and, in some cases, increase the risk of serious complications. The good news is that many of these mistakes are preventable. In today's video, I'm going to share the 5 biggest mistakes every cancer patient should avoid. If you or someone you love is fighting cancer, make sure you watch until the very end, because the 5th mistake is one that many people don't realize they're making. Let's get started. The first mistake many cancer patients make is trying to continue life exactly the way they did before their diagnosis. Many people think, I still feel strong, so I can keep lifting heavy things, carrying furniture, climbing multiple flights of stairs, or doing physically demanding work. Unfortunately, that isn't always safe. Cancer affects every person differently. Some people have cancer that has weakened their bones without obvious symptoms. Others may have cancer that has spread to the spine or other parts of the skeleton. In those situations, heavy lifting or putting too much stress on the body may increase the risk of fractures or other serious complications. That's why doctors often advise certain cancer patients to avoid heavy lifting until they understand how strong their bones are and what level of physical activity is safe. Another common mistake is refusing to ask for help. Many people don't want to become a burden on their family. They continue carrying heavy grocery bags, lifting water bottles, moving furniture, or climbing stairs again and again because they don't want anyone to think they're weak. But protecting your body isn't weakness. It's one of the smartest decisions you can make during cancer treatment. This doesn't mean every cancer patient should stay in bed all day. In fact, many patients benefit from gentle physical activity. Light walking, stretching, and exercises recommended by a doctor or physical therapist can help improve circulation, reduce fatigue, maintain muscle strength, and support recovery. The key is finding the right balance. Don't push your body beyond what your healthcare team recommends. If you experience severe back pain, numbness, weakness in your legs, difficulty walking, or problems controlling your bladder or bowels, don't ignore those symptoms. Seek medical attention immediately, because they can sometimes be signs of pressure on the spinal cord that requires urgent evaluation. It's also important to understand that recovery is not a competition. Some people compare themselves with friends or relatives who also had cancer. They say, they were still working every day. They kept going to the gym. They lifted heavy objects. But every cancer diagnosis is different. Different types of cancer affect the body differently. Different treatments have different side effects. Different patients have different levels of strength. Your recovery plan should never be based on someone else's experience. It should always be based on your doctor's recommendations. During treatment, your body is already working incredibly hard. Chemotherapy, radiation therapy, surgery, targeted therapy, and immunotherapy can all place additional stress on the body. Giving your body enough time to recover is just as important as receiving the treatment itself. Remember, there is absolutely no prize for pretending to be stronger than you really are. The goal isn't to prove your strength. The goal is to recover safely. If something feels too heavy, ask someone to help. If your doctor tells you to avoid lifting heavy objects, follow that advice. If climbing several flights of stairs leaves you exhausted or causes pain, tell your healthcare team. Small decisions like these may help reduce unnecessary strain on your body while you're going through treatment. Always remember this. Protecting your body today gives you a better chance of staying stronger throughout your cancer journey. Now let's move on to the second mistake that many cancer patients make, and it's one that delays treatment for far too many people. The second mistake many people make is waiting too long before seeing a doctor. After noticing unusual symptoms or even after hearing the word cancer, some people convince themselves that everything will be okay if they just wait a little longer. They might say, "I'll go next week. Maybe it's nothing serious. The pain will probably go away." Or, "I don't want to hear bad news." Unfortunately, delaying medical care is one of the biggest mistakes a person can make. Cancer doesn't always cause severe pain in the beginning. In fact, Many types of cancer can continue growing silently without causing obvious symptoms. A person may feel almost normal while the disease is progressing inside the body. That's exactly why early medical evaluation is so important. The sooner you visit a doctor, the sooner they can begin finding answers. Your doctor may recommend blood tests, a biopsy, or imaging tests such as a CT scan, MRI, PET scan, or other examinations depending on your condition. These tests help doctors answer some very important questions. What type of cancer is it? Where did it start? Has it spread to other parts of the body? If it has spread, how far has it spread? What treatment offers the best chance of controlling or treating the disease? Without this information, doctors cannot create the best treatment plan for your specific situation. Every cancer is different. Some cancers grow slowly over many years. Others can grow much faster. That's why nobody should assume their situation is the same as someone else's. Many patients delay because they feel afraid. Some are afraid of hearing the diagnosis. Others worry about treatment, cost, or the possibility of surgery. Those feelings are completely understandable. But fear should never stop you from getting the medical care you need. Remember this: knowing the truth is always better than living with uncertainty. Even if cancer is confirmed, finding it earlier often gives doctors more treatment options than finding it later. Another mistake people make is relying only on internet advice or home remedies instead of getting examined by a qualified healthcare professional. The internet contains useful information, but it also contains dangerous myths. No YouTube video, no Facebook post, no friend, and no family member can tell you exactly what's happening inside your body. Only proper medical tests can do that. If you've already been diagnosed with cancer, don't delay your follow-up appointments either. Sometimes patients begin feeling a little better after treatment starts. Because of that, they think they don't need to return to the hospital. But follow-up visits allow doctors to monitor your progress, evaluate how well the treatment is working, and make changes if necessary. Missing appointments may delay important decisions about your care. Your doctor is your partner throughout this journey. The more closely you follow your appointments, the better your healthcare team can understand your condition and respond if anything changes. Remember, time matters. The earlier doctors understand what's happening, the sooner they can recommend the most appropriate treatment for your condition. So if you notice unusual symptoms, receive an abnormal test result, or have already been diagnosed with cancer, don't wait. Make the appointment, ask questions, follow your doctor's advice. Taking action early can make an important difference in planning the best possible treatment. Now let's move on to the third mistake, a mistake that many patients make every single day without even realizing how important it is. The third mistake many cancer patients make is not taking their nutrition seriously. After being diagnosed with cancer, some people continue eating whatever they want, while others suddenly stop eating certain foods because they heard advice on social media, YouTube, or from friends and relatives. Unfortunately, not all of that advice is accurate. During cancer treatment, your body needs proper nutrition to help maintain strength, support healing, and cope with the side effects of treatment. Chemotherapy, radiation therapy, surgery, and other cancer treatments can place significant stress on the body. That's why what you eat becomes more important than ever. Many patients lose their appetite during treatment. Some experience nausea. Others develop mouth sores that make eating painful. Some lose their sense of taste, while others feel full after eating only a small amount. These challenges are common, but they should never be ignored. Instead of trying to manage them alone, talk to your doctor or a registered dietitian. They can recommend foods, meal plans, or medications that may help you continue getting the nutrition your body needs. Another common mistake is believing that one specific food can cure cancer. You may hear people claim that certain juices, herbs, special diets, or supplements can completely eliminate cancer. While some foods are healthy and can support your overall well-being, there is no single food or miracle diet that has been proven to cure cancer on its own. Cancer treatment should always be guided by qualified healthcare professionals. Some patients also begin taking large amounts of vitamins, herbal products, or nutritional supplements without telling their doctor. This can be risky. Certain supplements may interact with cancer medications or reduce the effectiveness of treatment. That's why you should always discuss any supplement or herbal product with your healthcare team before using it. Hydration is another important part of your recovery. Drinking enough fluids helps support many normal body functions, especially during treatment. If you're having trouble drinking because of nausea or other side effects, let your healthcare team know so they can recommend safe ways to stay hydrated. Remember, every cancer patient is different. The best nutrition plan depends on your type of cancer, your treatment, your medical history, and your current health. The eating plan that's right for someone else may not be the right plan for you. That's why comparing yourself with other patients can sometimes do more harm than good. If your doctor recommends eating more protein, increasing your calorie intake, avoiding certain foods, or making temporary dietary changes during treatment, those recommendations are based on your specific medical condition. Trust the professionals who understand your case. Good nutrition cannot replace cancer treatment, but proper nutrition can help your body stay stronger during treatment, support recovery, and improve your overall quality of life. So don't depend on random advice from the internet or people who don't know your medical condition. Follow the nutrition plan recommended by your doctor or dietitian. If something isn't working for you, ask questions. If you're struggling to eat, tell your healthcare team immediately. Taking care of your nutrition is one of the most important ways you can support your body throughout your cancer journey. Now let's move on to the fourth mistake, one that many patients overlook, but that plays a major role in helping doctors make the best treatment decisions. The fourth mistake many cancer patients make is refusing, delaying, or skipping the medical tests their doctor recommends. After receiving a cancer diagnosis, some patients think, "I've already had enough tests. I feel okay now, so I don't think I need another scan." Or, "These tests are probably unnecessary." Unfortunately, this way of thinking can create problems because every test gives your healthcare team important information about your condition. Depending on your type of cancer, your doctor may recommend tests such as an MRI, CT scan, PET scan, bone scan, ultrasound, blood tests, or even a heart test like an echocardiogram before or during treatment. Many people don't understand why so many tests are needed. The answer is simple. Each test has a different purpose. Some scans help doctors determine the exact location of the cancer. Others show whether it has spread to nearby tissues, lymph nodes, or other parts of the body. Some tests measure how well your treatment is working. Others help doctors decide whether your treatment plan should continue exactly as it is or whether changes are needed. For certain treatments, doctors also need to make sure your heart, kidneys, liver, and other organs are healthy enough before treatment begins. That's why additional tests may be recommended throughout your cancer journey. Another mistake patients make is missing follow-up scans because they start feeling better. Feeling better is wonderful, but symptoms alone cannot tell doctors whether the treatment is working exactly as expected. That's why follow-up imaging and laboratory tests remain an important part of cancer care. Many cancers require regular monitoring even after treatment has started. Some people compare themselves with another patient and say, "My friend had cancer and never needed this scan." But every cancer is different. Every patient is different. The stage of the disease, the location of the cancer, the treatment plan, and your overall health all influence which tests your doctor recommends. Your treatment plan is designed specifically for you, not for someone else. If you're worried about the cost, preparation, or purpose of a test, don't simply skip it. Instead, ask your doctor why the test is important. Most doctors are happy to explain how the results will help guide your treatment. Understanding the reason behind each test often helps reduce anxiety and gives patients more confidence in their care. Remember, these tests are not performed just for the sake of doing more tests. They provide valuable information that helps doctors make safe and informed decisions about your treatment. Without accurate information, it's much harder to know whether the cancer is responding to treatment or whether another approach may be needed. The more complete the information your healthcare team has, the better they can personalize your care. So don't ignore appointments for scans, blood work, or other recommended examinations. Follow your doctor's instructions, complete the necessary tests, and ask questions whenever something isn't clear. Those test results may provide some of the most important information your healthcare team needs to help guide your treatment safely and effectively. Now let's move on to the fifth and final mistake. A mistake that many patients make after they begin feeling better, and one that can affect their long-term care. The fifth and final mistake is one that many cancer patients don't realize they're making: stopping treatment without their doctor's approval. This often happens when a patient starts feeling better. The pain becomes less severe, their energy begins to return, they can eat better, or their latest test results show improvement. At that point, some people think, "I'm feeling fine now. I don't think I need any more treatment." Unfortunately, that's a mistake that can affect the success of their care. Feeling better does not always mean the cancer has completely disappeared. In many cases, doctors continue treatment even after symptoms improve because the goal is to destroy as many remaining cancer cells as possible and reduce the risk of the cancer returning. That's why every treatment plan is carefully designed by your healthcare team. Whether you're receiving chemotherapy, radiation therapy, immunotherapy, targeted therapy, hormone therapy, surgery, or another form of treatment, every appointment and every treatment session has a purpose. Another common mistake is missing follow-up appointments after treatment has finished. Some patients believe that once treatment is over, they never need to see their doctor again. But follow-up visits remain one of the most important parts of cancer care. During these appointments, your doctor may perform physical examinations, blood tests, or imaging studies to monitor your recovery, check for possible side effects, and watch for any signs that the cancer may have returned. These visits give your healthcare team the opportunity to act early if anything changes. Remember, every patient's journey is different. Some people complete treatment in a few months. Others need treatment for a longer period or require regular monitoring for years. The right time to stop treatment should always be decided by your doctor, not by how you feel on a particular day. If treatment becomes difficult because of side effects, don't stop on your own. Talk openly with your healthcare team. In many cases, doctors can adjust medications, manage side effects, change treatment schedules, or provide additional support to help you continue safely. Never be afraid to ask for help. Your doctors, nurses, and other healthcare professionals are there to support you throughout your journey. The most important goal is not simply to start treatment. The goal is to complete the treatment plan safely under your doctor's guidance. Stay committed, attend every appointment, take your medications exactly as prescribed, complete the recommended tests, follow your nutrition plan, and always communicate with your healthcare team if something doesn't feel right. Those small decisions can make a meaningful difference throughout your treatment journey. Final thoughts. If there's one message I hope you remember from today's video, it's this. A cancer diagnosis can be overwhelming, but you're not alone. Every decision you make during treatment matters. Avoiding these 5 common mistakes can help you and your healthcare team work together toward the best possible outcome. Let's quickly recap today's 5 mistakes. Number 1. Don't push your body beyond your doctor's recommendations. Number 2. Don't delay seeing a doctor or attending follow-up appointments. Number 3. Follow the nutrition plan recommended by your healthcare team. Number 4. Complete the tests and scans your doctor recommends. Number 5. Never stop treatment unless your doctor tells you it's safe to do so. Thank you so much for watching. If you found this video helpful, please give it a thumbs up and share it with someone who may benefit from this information. And don't forget to subscribe to the channel and turn on notifications so you never miss our future videos about cancer awareness, treatment, recovery, and healthy living. Take care of yourself, stay informed, and I'll see you in the next video.